Environmental public health tracking, investigating the links between our environment and health. An environmental health hazard is a substance that has the ability to cause an adverse health event. This includes physical, chemical, and biological factors. Examples include air, water, and soil pollution from transportation, agriculture, industry, and other sources such as chemicals, toxic waste, radiation, pesticides, heavy metals, climate, extreme temperatures and weather events, where you live, home and community design, and chemicals in consumer products. The most common environmental health hazards are air and water pollution. Understanding the health effects from an exposure to an environmental hazard is complex and requires information and understanding of several factors. These factors include the dose, how much of the hazard a person is exposed to, the duration, how long a person was exposed, the exposure route, how they came into contact with the hazard, and personal traits like age, diet, and genetic factors. The unique set of factors that determine if a person will get sick from an environmental exposure make it difficult to predict the health effects associated with them. Environmental hazards can have subtle effects on our health. Depending on the contaminant, the resulting effect can take time to develop. It can appear differently in one person to another, or depending on the amount, no health effect may appear. Some effects can go unnoticed for years or decades. A single exposure or single chemical may not trigger an illness, but an accumulation of exposures over time can take its toll. Health effects from the environment can be short-term, acute, or long-term chronic. Acute conditions are severe and sudden in onset. Examples include an asthma attack or heart attack. Chronic conditions persist over a longer period of time, usually at least 3 months or more. Examples include cardiovascular disease, asthma, diabetes, and cancer. Science has proven some links between health conditions and the environment. For example, we know poor air quality can trigger asthma, and that elevated blood lead levels in children can cause developmental disabilities. We also know that vulnerable populations like the elderly and infant are more at risk to heat-related illness during heat waves, and that extreme weather that causes power outages can lead to cases of carbon monoxide poisoning. However, many links are suspected but not yet proven. Environmental health is a complicated area of study, and there are gaps in information about how the environment affects chronic disease. Health problems with suspected links to environmental issues include certain cancers, asthma and respiratory diseases, neurological diseases, Parkinson's disease, multiple sclerosis, Alzheimer's disease, developmental disabilities such as cerebral palsy. Why do we care to understand the connections between the environment and health? Prevention. The more we know about the health consequences of an environmental hazard, the better we can protect public health through policies, education, and community outreach programs. Knowing that the elderly are among the most vulnerable to heat illness during a heat wave has led to community outreach programs nationwide that educate citizens about the importance of checking on elderly family and neighbors during an extreme heat event. The Environmental Public Health Tracking Program has been working over the last 2 decades to address the gap in understanding how the environment impacts health. Through the linkage of environmental and public health data, the Environmental Public Health Tracking Program provides essential data and information to help drive innovative programs across the nation and improve public health. The tracking program provides expertise, data, and tools to inform decisions about allocating resources, planning interventions, and evaluating efforts to protect and improve the health of communities. An important feature of the program is the Environmental Public Health Tracking Network, which integrates hazard, exposure, and health effect data in a standardized format. Integrating all of these elements makes environmental public health tracking unique. Once these data are integrated, they can be analyzed, interpreted, and disseminated to the stakeholders who need this information. Stakeholders include a wide variety of audiences, such as federal, state, and local agencies, academia, policymakers, media, and the public. From there, these stakeholders can take the data to do further research, make assessments, develop interventions and policies. The Environmental Public Health Tracking Network is an online system that has health exposure and hazard information and data from a variety of national, state, and city sources. The 4 types of environmental public health data available in the tracking network are environmental hazard, exposure, health, and population data. Each data set plays an important role in helping environmental health professionals understand the connections between environmental hazards and health outcomes. These data can help us address questions like What are the hazards to health in our environment? Are communities being exposed to harmful pollutants? Are environmental exposures and population exposures related to increased disease? Environmental hazard data provides information about the distribution and concentration of pollutants in the environment. As listed, there are a wide variety of environmental hazard topics available to users of the network. For example, the tracking network has data on drought duration and severity in the United States. Understanding drought trends is important for public health professionals, water and sanitation officials, and policymakers for community planning purposes. Although many factors influence how drought will affect a community, drought trend data and other related indicators can be used to prepare for and prevent potential health risks. Health effect data also play a vital role in tracking efforts. Data exists on a variety of health conditions from chronic to acute illnesses to injuries and disabilities. These data come from a variety of sources, including the census, electronic medical records, national surveys, surveillance systems, and vital statistics. For example, the tracking network includes data on asthma hospitalizations and asthma prevalence, which is the number of people diagnosed with and living with asthma. These data are useful in providing estimates about where and to what extent asthma impacts different populations. They can be used to plan and evaluate asthma interventions. Exposure data also play a vital role in tracking effort. Exposure data or biomonitoring is the measuring of chemicals or environmental exposures in individuals. Most biomonitoring involves measuring the amount of a chemical or its breakdown product, a metabolite, in a small sample of a person's blood or urine. Biomonitoring data come from CDC's National Health and Nutrition Examination Survey. Biomonitoring data can be used to find out what chemicals people are exposed to and the levels of the chemicals found, evaluate prevention efforts, and determine if exposure levels are different among potentially vulnerable groups. Population health data can provide context about relationships between exposures and health effects. Information about age, sex, race, and behavior, or lifestyle may help us understand why a person has a particular health problem. Data sources for population characteristics on the tracking network include CDC's National Vital Statistics System and the U.S. Census Bureau. To access the data on the tracking network, you would need to use the Data Explorer. This tool allows you to search for a variety of environmental and public health data. Conducting a search is very easy. The first step is to select your content. The content area is the health condition, hazard, or population characteristic you're interested in. From there, you would select an indicator, which is a specific type of data that helps describe the content area in more detail. These would be things like incidence, prevalence, levels of a contaminant, or demographics. From there, you would then select a measure. Each indicator has at least one measure. A measure is a summary characteristic or statistic such as number, sum, percentage, or rate. Some specific examples are shown here. If you're interested in looking at cancer, you could search for cancer data by incidence of bladder cancer, which would give you the annual number of cases of bladder cancer in a given time frame. Once you've selected your content, you will need to select the geography. Next, you can select the time frame, and from there, some of the data have advanced options like breakdowns by age, race, or gender. Once you have completed your search, you will be able to view the information in a variety of formats, such as maps, tables, and charts. The tracking network is more than just data. Next, I'll play a short video that describes other aspects of the program and how the data is used to improve public health.
Our personal health is affected by the health of our environment. We must care for both to stay healthy. Understanding our connections to the world we live in is important. The Centers for Disease Control and Prevention is working to improve our understanding of those connections. CDC's Environmental Public Health Tracking Program uses a broad network of experts, data, and tools to connect environmental and public health information. This allows us to drive innovative programs and solutions that protect and improve the health of communities across the country. One way CDC's tracking program does this is through the Tracking Network, a dynamic system that provides researchers, public health professionals, and the public with information and data about environmental hazards, and the health problems that may be related to them. However, the tracking program is more than just data. Its resources and expertise help community leaders make informed decisions about allocating resources, planning interventions, and evaluating efforts to improve public health and potentially save lives.
Environmental public health tracking data are tremendously useful in planning purposes. They're tremendously useful in environmental regulatory decision-making purposes, and they're useful in prevention activities.
So much of what we do in public health relies on good, sound data. The thing that we're excited about with this dashboard is that it begins to allow us to have a more efficient use of that data, a more efficient use of staff time, and we can begin to pull data sets together to establish some of those understandings about what may be going on here between the environmental exposures that are out there and the health outcomes that we have, and really begin to cause us to take a step back and look at what are those relationships and what are the things that we need to put towards those understandings in terms of research efforts, resources to address policy issues that may be of concern, or other uses of data that we haven't yet thought about.
What this means is that we have this talented, experienced, trained staff to investigate and monitor environmental health issues, and then to take that information and be able to inform and educate the community.
In collaboration with experts and partners, the tracking program is committed to improving health outcomes across the nation. With better information, the tracking program empowers communities to become healthier. CDC's Environmental Public Health Tracking Program. Better information for better health.
The tracking program has a national and local network. CDC maintains the national network and then funds states like ours to both contribute to the national network and develop and maintain our own local network. Currently, CDC funds 26 states and local health departments to build and implement local tracking programs and data networks. State and local data systems feed into the national tracking network. Some of the data we provide on the national network is on hospitalizations and emergency department visits, birth defects, and public water system data. Arizona joined the tracking program in 2017. We launched an improved Data Explorer in 2018. Currently, we have 400 environmental health measures and 3.8 million rows of data publicly available. Much like the CDC, our data comes from many sources such as national and state agencies and nonprofit partnerships. Through data sharing agreements, our program is able to obtain drinking water data from the Arizona Department of Environmental Quality. Our program website can be found at azdhs.gov/EPHT. From here you can access our Data Explorer and Quick Reports tools. Both tools are helpful for viewing environmental health data in different formats. You can view contextual information for all the environmental factors included in the Data Explorer from these pages. You can gather information on the specific indicator available for viewing on the Data Explorer and its potential links to health. Likewise, on our Health Sections page, you can find information about the health conditions associated with various environmental exposures and information on prevention strategies you can take to protect your health. All our health and environmental data can be viewed as maps, charts, and graphs on the Data Explorer. Next, I'll play a video that provides an overview of running through a search and the different features on our Data Explorer.
Do you know what the air quality is like in your community? This video will demonstrate how to use the Arizona Environmental Public Health Tracking Data Explorer to learn about environmental hazards that could impact your health. It will cover how to construct a data query, as well as how the data will be displayed as maps, charts, and tables. To get started with the Arizona Data Explorer, go to azdhs.gov/EPHT and click on the Arizona Environmental Public Health Tracking, or EPHT for short, Explorer thumbnail. This will open a new window on your screen. Let's orient ourselves to the Data Explorer. We'll be starting with the Query Dataset panel on the left-hand side of the page. As we use the drop-downs to define our query, results will be displayed as a map, a table, and a chart. Map settings are found in the lower left-hand corner of the screen, and a legend is found in the lower right-hand corner of the screen. The size of any of the panels can be adjusted by clicking and dragging the gray dividing bars. First, choose your geography. This will determine the level at which the data will be displayed. All data are available at the county level, and a limited amount of data are also available at the sub-county level, where the state is divided into 126 communities. For public water systems, also commonly thought of as water utilities, data can be displayed by water system, where each point represents an approximation of where the water system delivers water. Next, choose the content area that you are interested in exploring. You can select environmental data, such as air quality or climate, or health outcome data, such as birth defects or cancer. Next, select an indicator that you would like to be displayed. The indicators are unique to each content area and allow you to select specific health conditions or environmental hazards of interest. If you want to know more about a particular indicator, click this icon. It will take you to a page that explains more about the different measures, how the measures were calculated, and how the indicator relates to the environment or health. Once you've selected your indicator, use the Measure dropdown to view variations on how your indicator is measured. For example, you could see the age-adjusted rate or average annual number of cases over a 5-year period. If you want to learn more about different measures, click the question mark icon next to the measure. This will open a pop-up window with the metadata, or additional details about the data, such as where it came from, why it was collected, and any limitations of the data. This information can also be found by clicking About at the top of the page. Finally, select the year of data that you would like displayed. Data may be displayed for single years, or for some indicators as multi-year periods. Depending on the indicator that you have selected, additional options may appear below the gray line. These dropdowns can be used to add additional levels of granularity to your data, such as age, gender, or ethnicity. You might also be able to select different pollutants or severity of environmental indicators. Next, we'll talk about how the data from your query are displayed. In the title, you will see all of the selections you made for your search, including selections made for each of the dropdowns in the query panel. If you would like to compare two data sets side by side, such as an environmental hazard and a health outcome, click the Add an Additional Map button at the top of the page. This will bring up a second map. You can also toggle back and forth between a map and a table for each query. Once you are finished viewing your second topic, click Remove Additional Map at the top of the screen. The legend displays the numeric value of the colors on the map. These can be divided in different ways with different cut points under Map Settings on the left-hand side of the page. Click the Layer List tab to add layers such as schools, hospitals, and tribal lands. Below the map, you can view data in a bar chart format. You can view the data over years or months depending on the topic selected. If you hover your mouse over any given bar, the numerical value will be displayed. The data are also visible in the Table panel, where you can view exact values for each county, as well as a benchmark or state average. You can also download the data as an Excel file using the Download Data button. The map, table, and bar chart are all linked, so if you highlight a county or other geography in any of the three, it will be highlighted in all panels. A highlighted county will also appear in the trend chart as a new line. Now you're ready to use the data. Make sure you read the disclaimer information by clicking About at the top of the page before you get started. Thanks for viewing our video. If you have any questions, please contact us at epht@azdhs.gov. Happy exploring!
One of the unique data sets we have on our Data Explorer is our food safety indicators. Data is taken from the ADHS Food Safety and Environmental Services Annual Report. Data captured in our portal is from years 2010 through 2018 and displayed at the county level. Measures include number of food establishments, number of routine inspections conducted by year and county. Let's take a look at what food safety data looks like on the Data Explorer. This search is looking at the number of foodborne illness complaints in 2018. You can easily pull the exact number of foodborne complaints by county from this chart and view trends over time for this and many other food safety related indicators. Pollution is one of the most common sources of environmental hazards. Data on air pollution can help us understand how often people are exposed to unhealthy levels of air pollution. We have several types of air quality data, including monitored PM2.5, ozone, and monitored PM10. Having these data can help public health professionals or policymakers understand which areas may be most in need of prevention and control activities. From the data dashboard, you can easily see that Pinal and Maricopa County had the highest percent of days above the air quality standard for PM10 in 2018. As we know, Arizona is one of the hottest places to live from May to September. Heat-related illnesses are common during the summer. Year after year, nearly 3,000 people visit Arizona emergency rooms because of heat-related illnesses. On the Data Explorer portal, you can view heat illness data at the sub-county level. This geographic unit allows for more targeted analysis of heat illness. These data allow us to identify populations in areas with high risk for heat-associated death. On this dashboard, I have highlighted the top 5 areas with the highest number of emergency department visits due to heat stress illness. Drinking water quality is an important public health issue because contamination in a single system can expose many people at once. On our Data Explorer, we have data and information about the levels of several contaminants that can be found in drinking water. While they are not gathered specifically to assess the level of exposure or to track changes in water quality over time, they can be used to determine the potential for public health impacts for contaminant levels of concern. On this dashboard, you can see the public water systems that tested above the maximum contaminant level for nitrate, and this information is linked to the population served by that water system. These are just a few of our most popular topics searched on the Data Explorer, but there are many more. The applications and uses for the tracking network are many, but anyone can access our website and tools to search environment and health data easily in one place, find contextual information and resources about how the environment may be affecting health, and use that information for a range of personal and public health actions. Alongside the Data Explorer, our program has developed tools like the Quick Reports. This tool provides data from the Explorer in infographic format. You can type in your address to get information for your neighborhood or smallest geographic scale we have available for that data source. You will be able to view locally relevant data for a variety of health conditions and environmental topics. The current topics available on our Quick Reports tool are demographics, extreme heat, proximity to highways, birth defects, asthma, heart attacks, and childhood lead poisoning. For asthma, the Quick Reports would pull the following information. You can see by sub-county emergency department visits compared to the state, symptoms related to an asthma attack, and information on exposure sources that can trigger asthma attacks. For each topic, we have a take action step to provide resources or information on how a person can take steps to protect their health. How has the data been used to affect public health? Since its start, tracking data and activities have informed over 500 public health actions in communities across the country. Public health actions use tracking data to identify and educate communities at risk, inform policies, target prevention strategies, improve surveillance, and impact state and city planning efforts. The next video describes how the Washington Tracking Program mapped out radon data to inform residents about the risk of their exposure in their neighborhoods.
I I chose to check my home for radon because when we were working on the radon project through the Washington Tracking Network, I saw that in my area through the geology risk map, there was a high risk for radon in my area. And when we were looking at the testing, there had never been any testing in my zip code. I wanted to check it to see because I have a basement and I have a child that's living in one of the rooms down in the basement as well as other children in the home. And us living here for a long time, I wanted to know if there was radon in the home.
Radon is a naturally occurring radioactive gas. It is odorless, tasteless, and invisible. So the only way to determine if you're being exposed to it is to test for it. Radon is considered a significant source of lung cancer for people who are non-smokers. And if you are a smoker and you're exposed to radon, it significantly increases your risk of getting lung cancer. The Washington Tracking Network has shown us that the problem is more broadly distributed than we previously thought.
We know from working with our radiation program historically that radon in Washington can be a problem. The Washington Tracking Network got involved with the radon program and developing these radon maps and tables, charts, to improve access to these data, making them available to the public, in hopes that these data, by making them available, people would use this information and make local decisions for testing in their homes, finding out whether they're exposed or not exposed, and to help improve their health.
Washington Tracking Network has previously only shown maps at the county level. This gives people a very broad view of what is happening in the state of Washington. With the development of this topic, we were able to bring the data down to a finer scale, zip code level. And so now people can see in their neighborhood what the differences are between their area and surrounding areas.
Because of the Washington Tracking Network, we are able to put data together that we've never been able to before. We haven't had the ability to provide the data to communities, to stakeholders, to local health jurisdictions in a way that they could effectively use it before now.
I would tell people that live in Washington about the radon maps that they need to look to see what area they live in. They need to see if they have a high, moderate, or low risk for radon, and especially if they live in a high risk area, they need to test their homes.
Without the tracking network, we would be struggling very much right now to address emerging issues. We would be struggling to link environmental exposure information with health outcome information. And more importantly, we'd still be struggling trying to make the connection with some of our programs. Tracking has really laid a strong foundation and fostered those relationships to the benefit of us all.
The tracking network is important. Through its many uses outlined here, the public and environmental health professionals can come to better understand how the environment is impacting our health. Ultimately, the tracking network improves and protects public health by giving scientists, researchers, public health professionals, and policymakers access to data that were previously not available in standardized formats. These environmental public health data can help us address important questions to understand the links between our environment and health.